We're doing a new series of interviews with doctors and nurses throughout Canada about their experiences in being on the front lines of the COVID-19 pandemic. So today we're going to be talking to Dr. Joe Vipond, who's an ER doc at the Calgary Foothills Hospital. And welcome to the interview, Joe.
And thanks for having me on, Markham.
Now, you and I have talked many times since the beginning of the pandemic, 9, 10 months ago. And you were telling me that the public's attitude towards doctors and nurses has really kind of changed since early in the pandemic. It is quite different now. Can you explain that?
Well, I'm sure it's not universal, but it is something that you're hearing on social media. Back in the spring, we were all in this together. We were a team. People were banging on their pots at 7 p.m., which was a bit of theatrics, but still felt good. People seem to be willing to make the sacrifices to protect us and to protect each other. Over the last few months, as the second wave has overwhelmed us, there's no longer that sense of camaraderie. We're seeing more pushback. We're seeing more anti-maskers online. People who say, my freedom is more important than your safety. And most importantly, I think, is we don't seem to have the backup of our leaders. We've gone to the point where the leaders aren't willing to make the hard decisions to protect our healthcare system and to protect our citizens. And so that's a kind of a gut punch.
Tell me about how that feels with you and your colleagues at the hospital. I mean, is this a topic of conversation?
Yeah, we all have that story of somebody who comes into the emerge and refuses to wear a mask, or the visitors that come in to visit their family and aren't wearing masks. That just makes our job hard. Like, it's hard enough as it is. We don't feel safe as it is because we're going in, like, every day we are exposed to COVID. And it should be nice if we had that sense that everybody was in there trying to protect us, especially in our workspace.
Now, you and I have talked over the months because you're an outspoken masking advocate. You've been arguing for mandatory masking for months now, and you've spoken out publicly about it. And so I can appreciate your frustration. And so what happens when somebody walks in the ER, doesn't have a mask, won't wear a mask? Can you turn them away? What do you do?
We've been given direction that visitors are no longer allowed in without masks. It's just not going to be allowed. For patients, a little bit more difficult. You can imagine sometimes a patient is sitting in our emerge for 6, 7, 10, 12 hours. They have to eat during that time. They have to drink. Sometimes they're demented, and so they have difficulty with even the ability of wearing that mask just generally. And that makes it tough. So we try and protect ourselves by, wearing the best mask that we can, making sure that on our side things are protected. We'll never turn anybody away just because they're not wearing a mask.
So what's it like, when you're in the emergency and COVID patients are coming in and you're having to deal with this? Give us a flavor of what it's like to be there.
So, in some ways, it's the same as it always was. People come in, they have symptoms, they have complaints. We investigate, we come to a diagnosis, we treat them. What's different is we always have to be in the back of our mind, is this COVID? COVID is such a sneaky little disease, I think probably the layperson always thinks of somebody coming in struggling for breath. But what we've found out is that people can present in multiple different ways. They can present with diarrhea, they can present with confusion, they can present with heart attacks, strokes. And so because it can be such a mimicker, we just have to have a really low threshold for keeping ourselves safe and wearing the right gear, and also testing and making sure that if and when they get admitted to the hospital, we've tested for COVID. So if anything, it's really made our spidey senses more acute in that sense. I think the other thing that has to be recognized is that there is a danger aspect to us being in the emerge, and they can't be avoided. It's part and parcel with our job. And so there's a little bit of tension, I think, that goes along with that. You never know. Is this the day that um, am I going to get it? And we know that healthcare workers are very susceptible to this.
Well, speaking of that, if you wouldn't mind sharing some insights into how your family has had it. I know that, or handled it. I know that you're for a little while your family was out of the house so that they would be protected. Do you mind sharing some stories about those conversations within your family?
Yeah, back in March, nobody knew really what was coming down the pipe. The kids were turfed out of school on March 17th. Everybody was told to stay at home. I was one of the workers that had to go out and still do work, and my work was admittedly risky place. And so we moved everybody to our in-laws, who, just as good fortune would have it, lived 5 doors down from us, so we could still hang out outside and share meals and that kind of thing. But we felt that was the safest thing to do. This second wave's been a little bit different. I'm still a high-risk person. I still have to go to work and be exposed. We know a little bit more about how things are transmitted, and so we know that our safety practices, for the most part, are working. So that makes me a little more comfortable being in my household. The other thing that's changed is my kids are back in school. And although we've had these reassurances from our public health officials that schools are safe places, I think we can see by how things are wrapping up over the last 3 months that they're not really. Kids are just as likely to transmit them as adults. They're less likely to get sick. They're less likely to die, but they can certainly carry it either as asymptomatic spreaders or as mildly symptomatic. And so my kids are now, I would argue, are as likely to bring it into the household as I am. And so we're all still together and working on, bonding as a family.
What kind of tensions does that create? I can't imagine that it's business as usual in the Vipin household.
It is a bit business as usual. I think we're continuing to try and keep mentally healthy by doing outdoor activities, going skating, going cross-country skiing. The girls obviously have lots of extracurricular activities, which have had to either go virtual or be canceled. So, I think that's the biggest impact on their lives. We're doing more takeout.
Well, and understandably so. What about your colleagues? This must be a topic for conversation at the hospital during your shifts. How are they handling it at home?
There's a broad spectrum. I think I'm probably on this one edge of the spectrum that reads a lot and thinks a lot about what's happening, what the future holds. And then there's, people that are more on the, well, I'm just going to go to work and do what I'm told, and let's just hope things, pass. So it's really that broad spectrum. I don't think there's any normal response to a pandemic.
We interviewed Dr. Shazma Mirathani from the Royal Alex in Edmonton last night, and she was talking about how she and her colleagues are just exhausted. They've been at this 10 months now, and she's getting more COVID patients in their ER every day, and the workload is becoming quite, it's tiring and onerous. And are you and your colleagues finding the same thing?
We are about 10 days to 2 weeks behind the Edmonton numbers. If you actually look at how Edmonton is rolling out compared to Calgary, they've had it way worse in this second wave. And so they've been impacted earlier. I can imagine that that's going to be our future. At the moment, I'm seeing, one confirmed COVID patient a shift and admitting maybe one patient. That seemed to be kind of almost an order of magnitude less than what Shazmi's, I can't remember her last name, but the other doctor you interviewed is experiencing at this point. And the really, I think, worrisome part about all of this is we know it's going to get worse. We know that the numbers, whether it be cases or hospitalizations or deaths, are lagging indicators. That means that what we're seeing today is reflective of policies that were in place a week to 2 weeks ago. We haven't really had any new restrictions in place for many months now. We had some moderate ones put in 10 days ago, but they're not expected to impact our numbers at all. And because of that, we can only expect these numbers to climb for a minimum of 2 weeks, depending on how restrictive those new COVID measures are this afternoon.
So last question, Joe. We're seeing in the last 4 or 5 days in Alberta, daily infection numbers up around, between 1,500 and 1,600. Does that mean that in a week or two, you're going to be seeing a lot more really sick people in your ER?
Yeah, absolutely. We did the calculation. It's 3.5% of all cases end up hospitalized, 0.6% end up in the ICU, and 1% die. So from just to look at yesterday's numbers alone, from one day of 1,500 cases, that's about 60 people being admitted to the hospital, about 15 admissions to the ICU, and about, that's a little too high, about 11 admissions to the ICU and about 15 deaths from one single day. And we know we have multiple days, and we know that their numbers are going to climb. So you can imagine when we're talking about a tsunami of disaster ready to wash over us, it's because we can predict the future, and the future's bad.
Joe, thank you very much for this, and good luck on your shift tonight.
No problem. Thanks.